According to a recent survey by Twaweza, amongst Kampalans, 68% are willing to take COVID-19 vaccination jabs. Accordingly, 20% of respondents want every Ugandan to be vaccinated. 18% say the elderly should take the jabs, 12% by health workers, and 11% want teachers to be vaccinated. At least 19% of those who don't want to be vaccinated doubt the relevance of the vaccines. 12% say the vaccines haven't been approved. 10% say the vaccines could have side effects. 6% are worried about the vaccine side effects, and 1% have other health complications. At least 37% of the respondents want government to sensitize Ugandans about vaccinations, as many complained about long journeys trekked to reach vaccination centers. 3% want government to avail health workers' facilities for door-to-door vaccinations. The program's manager, UNEP, says there are issues concerning misinformation about COVID-19 vaccination amongst Ugandans.
When guidance is given on how a product is supposed to be used, the manufacturer has more information than us.
An expert in children-related health issues, Dr. Sabrina Chitaka, says children below 18 years are not eligible to COVID-19 vaccines and warns parents against overusage of antibiotics to treat children.
I know that parents were rushing with their 13-year-old children to get the vaccine, but we are not yet ready to offer the vaccine to children below 18 years.
Dr. Annette Chisache, a COVID vaccination expert, however, warns and asks the public to raise an alarm to health experts whenever side effects arise. She says the use of Astrazeneca vaccine is to prevent the public from being admitted to hospitals.
We are confusing the entire system. The vaccinologists are wasting their effort, the right ones, wasting their efforts trying to fight the social media vaccinologists. And yet we should be focusing on the right vaccinologists. Follow the other authentic websites, the WHO website, the CDC website. They have a lot of information. And then we can probably ask questions from that information. What does this mean?
The Regional New Vaccines Introduction Office, Regional Office for African Congo-Brazzaville, Dr. Fiona Atuhewa, says Uganda has so far received 0.48% of vaccines out of the required to cater for the entire population.
The COVAX facility was started by WHO, co-led by Gavi, the Vaccine Alliance, and another organization called CEPI, which is the Coalition for Epidemic Preparedness and Innovations. And these three worked together to put together the COVAX facility, whose job really was to ensure that we get equity when it comes to vaccine availability, more so to poorer nations.
Dr. Alfred Riwali said that some people suffered from other diseases like tuberculosis, high blood pressure, other than vaccination, which escalates infection. AstraZeneca and Johnson & Johnson vaccines have been approved worldwide for use against COVID-19. Dr. Riwali says there are no more mass vaccinations to help reduce the great numbers of the second wave. Experts also say that there is no problem vaccinating before one tests for COVID-19. Ivan Juko, UBC News.